In Good Health, brought to you by McLaren Northern Michigan.
The spine's a really cool area. Yeah, really only something a spine geek like me would think, right? I'm Dr. Joe Weistroffer, an orthopedic spine surgeon at McLaren Northern Michigan. When you think about it, there's hardly ever any injuries in this part of my back, my thoracic spine, from where the ribs start to where the ribs end. And the reason for that is because there's two columns. There's your spinal column with its bones, the vertebra, then it's attached with bone, your ribs, up to your sternum, and that provides two columns. And so this area here is rarely injured, and if it is, it's mainly from the muscles. Now the next, a different issue, it's got tons of muscles, and usually it's a neck issue, but it's a single column. But interesting, your head, which is about 10 to 15 pounds, sits on top of it and it's kind of balanced. And so it's not as big a deal. But your lower back is a very big deal, and proper lifting technique is really, really important. And that is because from your lower ribs to where your pelvis is, those 5 lumbar vertebrae are all by themselves. And so whenever you lift things, it's really important lifting technique is to keep your shoulders over your hips as you squat. The hard part about doing that is as you get older, your hips and your knees start to be arthritic, and that starts to be painful as well. But that's how we expect to do it, because when you squat to do it, it's your legs doing the lifting, not necessarily your back. Especially when you bend and squat to get something and you hold it close to your body, you're holding it and it's centered and it's balanced, and it's much safer for you to do. Now, even when you do this, the spine is at its most vulnerable as you're lifting. If you twist, the spine, as it twists, because there's a lot of motion there, it's very vulnerable to being injured. And that's why if you want to pick something up and put it on the counter next to you, you want to move your feet to do so. You don't want to necessarily twist, because then your spine is vulnerable. That's the secret to proper lifting. And that's why if you bend forward to touch anything, let's say I drop a paperclip and I bend forward to pick it up, and all of a sudden my back starts to hurt. It's like, that's not right. How can a paperclip make my back hurt so much? Your brain is only registering picking up that paperclip. But in reality, your brain thinks that, but what your lower back is picking up is a little teeny paperclip, 15 pounds worth of head, 60, 70 pounds worth of shoulder and chest, not just a couple inches away, but 2, 3 feet away. And your lower back has to do all of that. It's a huge fulcrum, and it can be very detrimental to your back, especially when you combine this with that twisting motion I was telling you about. That's why it's so important to squat and pick up and hold close to you and lift up. And that's what's really important about lifting. Now, there's also some general rules. Is you don't want to lift something too heavy, get someone to help. Use your brains instead of your back as you get older, and you have to do these lifting things that go to it. That's why it's so important, though, if you do have a lot of heavy lifting in your job or whatever, to try to make sure that you keep your weight under control and you leave a healthy lifestyle, and that you try to avoid repetitive motions, but always try to remember the good technique. Now you can see why it's so important to build your stomach and your abdominal muscles and your back muscles. It's also important to keep your hamstrings stretched out correctly, because if your hamstrings are tight, it changes how your pelvis sits, and that changes how your spine curves. And if they're tight, it gives your subconscious mind less of the ability to generate how much curve you should have in your back. So if you keep your hamstrings stretched, it helps your body regulate your lower back better. If you keep these stomach muscles strong, when they contract, they push in all your guts, and it starts to create that second column to support the back bony column. And that's what helps make it safer to lift. So when you lift heavy, you want to tighten those stomach muscles as strong as you can, and you want to pick with your shoulders over your hips. You want to lift up, avoid twisting. You want to move your feet that goes with it. Be smart in how much you lift, and never do the repetitive motions that go with it.
For more information or to schedule an appointment, go to mclaren.org/northern or call 800-248-6777.